Early this morning, Bernarda Wang, otherwise known as Bernie Wang, passed away in her sleep. Many of us have known and loved Bernie for many years. She was a co-founder of Chinese American Service League and had been a leader in Chinatown for decades. So I'm going to ask the other speakers to each say a little bit of, talk a little bit and give a short tribute of Bernie Wang, share a story about Bernie. Thank you. We'll start with David.
So I'm David. Bernie actually gave me my first job in human services. It was, I think Tiffany doesn't even know this, but I was the summer youth instructor for employment program for youth. So Bernie told me at the end of the summer, David, you're a wonderful person, but your Chinese is terrible. If you could learn more Chinese, I'll hire you. And so I never really succeeded at her advice for me. But throughout the years, I've seen Bernie so many times at so many meetings. One of the things that everyone knew was that no matter what meeting we were in, whether it was with the city or with the state or anywhere, she would always talk about the needs of Chinatown. You know, right now people are saying that we're silent, but she always spoke up for the things that we needed, the things that Castle needed. And so it's, you know, our community, for how it's grown and how we've cared for immigrants, so many people have been served by Castle, and so many people have who've volunteered or worked at Castle, work in so many different places around the city, doing good work. And so it's important that we recognize her.
Thank you so much, David. And next we'll hear from Jered.
Thanks, Grace. Yeah, I'm Jered Pruitt. I'm the Chief Operating Officer for the Chinese American Service League. So before I started this position that I have now, I worked under Bernie as a Director of Development. So Bernie and I, our jobs were to raise funds to support Castle and to support the community, which allows us to serve the people out in the community. And I think two things really have struck me with Bernie that I've never really ever seen before in a leader. And I've been in many different communities across the state. And two things. One is that Bernie was a very persistent person. She never gave up. She never took no for an answer, ever. That's why you know, I've been in rooms with political leaders, with the mayor, with the governor, and they have told me before, it's when Bernie calls and they see Bernie's phone number pop up, you take the call from Bernie. Because if you don't, she will call right back and again and again. And that persistence gave her a voice, and it gave the community a voice as well. And that's something that I wanted to share with you all, because I think those are really valuable traits as for those of you who consider or wanting to become future leaders of the community. It's having a voice, knowing what your voice is, and using it. That's really critical. Thank you, Grace.
Thank you so much, Jered. Ben.
Hi, everyone. My name is Ben. I know Bernie for a long time. I would say since 1999 when I first came to this country, and when I find my first job at Castle, and I was interviewed not only by the related manager but also by Bernie. To me, Bernie is a very energetic, lady, and like Jered mentioned, that she's very persistent. I have been with her to a number of events. She was always running around like a rabbit, not only chasing politicians and funders for funding opportunities. She also wants to know as many people as possible, and she also always went into the community to meet the residents and talk with them and try to understand what their needs are. And You know what? Words cannot even begin to describe my sorrow. I've been knowing her for such a long time, over 20 years. So she's an amazing, hero and community leader that we all should learn from her. Thank you.
Thank you so much, Ben. And then Hong.
Hi, my name is Hong Liu. I'm an executive director of the Midwest Asian Health Association. I just really feel sorry that the Bernie has left forever from us, from our life. Bernie, I know Bernie for many years. We both work for non-for-profit organization for many years, and we both are executive directors, devoted most of our life and time to non-for-profit organizations, to people who are in need of social services. Bernie is really my colleague, my role model, and my hero. We share the same mission, which is to serve people in need. We work together to develop health programs for the Chinese community. I just feel so sorry that she passed away. I think since she has devoted most of her life to the community and to the people's life, I think she will always be remembered by all of us. Thank you.
Thank you so much, Hong. And I am Grace Chen. I'm the Executive Director for Coalition for Better Chinese American Community, CBCAC. I also met Bernie about the same time that David did, in the early 90s. When I was a grad student, I taught a summer program at Chinese American Service League at Castle, and met Bernie then. Just like the rest of the folks had mentioned, Bernie has been persistent. She always cared about the people that she served, and she's always coming up with ideas to raise more money or organize new programs. One of the things that I remembered most was that when I later worked again at Chinese American Service League at the Director of Administration, she would go to meetings, and she would always go to events, and she would always set herself a goal of meeting at least 3 people or at least 5 new people. And she would always be very persistent and relentless in that. We will all miss Bernie for the 4 or 5 decades of her leadership. And it is just fitting that since we are having a meeting about meeting Chinatown leaders, that we like to give you all a little bit of a chance to meet Bernie Wong as well. So now I'd like to have all of us have a moment of silence for about 15 seconds or so, and then we can begin our program. Thank you. Thank you, everyone. Now we're going to begin our program. Eva?
Yes, thank you, everyone. I am going to really quickly stop share and share again. 1 second. But today we will be meeting some very amazing Chinatown leaders who we have here. 1 second, my computer's ringing out. My name is Eva. I'm the lead organizer at CBCAC. And a little bit about CBCAC, we're a civic engagement nonprofit that works in the greater Chinatown area so that our communities can essentially get the support and the resources that we need. So we're just one of many, many organizations that work in the Chinatown community, and you're also going to get to know a couple more with our leaders. I'm going to share screen again. Sorry, everyone. So these are a couple of our leaders who will be joining us for a very, very many. So we have Hong, Ben, Jered, and David, and you'll get to know a little bit more with their introductions. skip that for a second. So we'll quickly introduce each leader for about 20 minutes, and then we're going to go into small breakout rooms for question and answers, or just specifically chatting with the leaders on a very personal level. And we'll get to instructions on that end too. And then we'll end it in this big main session. So I will hand it off to our featured leaders to tell us about their journey, and their impact on our community. And Ben will be first.
Hi, everyone. Again, my name is Ben Lau. I am the Executive Director of the Chinese American Museum of Chicago, CAMOC, which I joined 2 years ago. I relocated to this country from Hong Kong in the fall of 1999 to reunion with my elder sister, who sponsored my immigrant visa. I was born and raised in Hong Kong together with 5 siblings in a working class family. My father passed away while I was still in elementary school. My elder siblings had to drop out from high school and come out to work in order to help my mother support the family. I graduated from high school and earned my college degree by being a private tutor for elementary and high school students. I had worked as a reporter with the Hong Kong TVB and editor with International Financial News Department of Hong Kong Xingtao Daily, a freelance writer and columnist for several newspapers and magazines, and an educator before I left my beloved city, Hong Kong. Then I came to the United States. I earned my living by starting my first job with the Chinese American Service League, that is CASL, working as an employment counselor. I earned my second degree while I worked full-time. With my background in information technology, I helped the employment department develop its first database and case management system for job seekers and employers. And along the years, I gradually established my second career through promotions. My job title has been changed from employment counselor to employment coordinator in just 2 years. In 2005, I took on the challenge of developing a new housing initiative for CASL as their housing coordinator to address the needs from our community. Through taking numerous classes, I became a certified housing counselor as well as financial coach, and helped CASL become the first bilingual English and Chinese HUD approved housing counseling agency in the city of Chicago. HUD stands for U.S. Department of Housing and Urban Development. I employed a number of creative and culturally competent approaches to promote and market the housing and financial programs and services. I was dedicated to raise awareness of better money management in the Chinese community, and proud to launch the first credit building lending circles, as well as individual development account, IDA, now known as Matched Savings Program, in the Chinese community. After seeing the needs and hearing the voices from our community, I expanded the scope of services to include low income home energy assistance program, what we call LIHEAP, home weatherization, rent assistance, down payment assistance, and served over 2,500 households a year. In 5 years, the housing initiative was eventually separated from the employment department, evolved and grew into a new department, the Housing and Financial Education Department, HFED, in 2010. And I was promoted to the manager of the new department. In 2017, I became the manager of the combined employment and financial empowerment programs. I currently serve as a vice president on the board of directors of Consumer Action, a national entity which advances consumer rights nationwide by referring complaints, publishing educational materials in multiple languages, advocating for consumers in the media and before lawmakers, and comparing prices on credit cards, bank accounts, and long-distance services. I was one of the directors of Chicago Long Kong Tianyi Association, a family association which engages in fraternal activities, such as providing a place for meetings, promoting social activities for members, and aiding new arrival members from mainland China, Hong Kong, and Taiwan. I also served on the local school council of Robert Healy Elementary School in Bridgeport for over 10 years and volunteered to help with a number of school events together with my wife. I try my best to follow the footsteps of Bernie and dedicate my whole career to work with other organizations to serve and fight for necessary resources for our community. Now, as the ED of CAMOC and also a Chinese American immigrant, I switched my focus from providing direct services to community members to advancing the appreciation of Chinese American culture and preserving the past, present, and future of Chinese Americans primarily in the Midwest. I hope my experience could give you a slight inspiration of becoming a community leader in the future. Thank you.
Yay! Thank you so much, Ben. Wow, so amazing. Well, if you want to keep your questions on the side or if you want to put them in the chat, you can, but just remember that we will be breaking out into small rooms with each leader, so you can chat with Ben directly and ask your own questions too, as with everyone else. So our next leader is Dr. Hong.
Hi, everyone. Again, my name is Hong Liu. I'm an executive director of the Midwest Asian Health Association. We are located in South Chinatown. It's a non-for-profit organization like CASO. Our mission is to reduce health disparities and improve community public health for medically underserved populations. I came to the US in 1988 to study my PhD degree. I received my master's degree in political science from UIC and my PhD degree in public policy analysis from UIC as well. After I graduate, I have been working for 3 non-for-profit organizations. I'm in this public health field for more than 20 years. I'm not quite sure if the students understand what's the difference between public health and medicine, or if you are major in public health, or if what's the difference from your major in medicine. So public health basically is to improve, to promote and protect the health of people and the communities where they live, learn, and work and play. While a doctor treats people who are sick, those of us working in the public health, we try to prevent people from getting sick in the first place. So if the public health people doing really, really good job, then the doctors will lose their job. So we try to keep people from hospital, from getting sick. So this is a huge job and it's not an easy job. So here are some examples of public health. For example, we provide vaccination to children, adults, and the seniors to prevent the spread of disease, like what we are doing for the COVID-19 immunization. So we encourage, educate people getting shots so they don't get infected with COVID-19 virus. We also educate people about the risks of alcohol or tobacco, smoking, so they don't get addicted. And you know, the smoking leads to lung cancer. We try to help develop school nutritional programs to ensure that kids have access to healthy food. And then public health also works to check disease outbreaks, like to study the outbreaks, why and where the virus disease start from. So that's the CDC is doing a lot of investigations to prevent the future outbreaks. And we also like to study and to investigate why some people are more likely to get sick and suffer poor health than others. So what are the factors, what are risk factors, and how people's people's diet and behavior related to getting sick. So all these are public health areas that we have been making efforts to do. So some of my house examples, my organization's examples in public health, for example, we have a hepatitis B program. The hepatitis B virus is one of the risks leading to liver cancer. So liver cancer is very prevalent among Asian populations. Even if our population, Asian population in the US is about 5%, but 50% of liver patients in hospital, 50% is Asian. So then how to prevent this? That's a public health issue. So we need to encourage people to get health screening to see if they carry the virus. And if they carry the virus, they can spread the virus without letting their families and even themselves know. So then we need to how to stop this virus from spreading to other people. We provide screening, we provide immunization, and early detection and treatment. Many examples about public health, how we prevent, for example, we educate people to get breast cancer screening, mammogram screening, colonoscopy screening for colon cancer. All these can be detected and prevented at the early stage, and the survival rate is high. You know, a lot of our immigrant populations, they work in restaurant, they work in grocery stores. A lot of small businesses, they cannot afford health insurance. So people without health insurance, they don't go for preventive care like annual checkup. And also a lot of our immigrants who don't speak English, they try not to go to hospital because they know that they cannot understand, go through the system. So MAHA has been trying to provide health screening programs for people who either no insurance or underinsured, or who have language and cultural barriers to hospitals. So we provide early detection and screening, so they know their blood sugar, high cholesterol, hypertension. You know, a lot of people working in the restaurants, they work long hours. They probably don't have their own selection of healthy food. They eat food in the restaurant. So then a lot of people don't know they have high cholesterol, they have high blood sugar or hypertension. We help them to get screening and understand those health risks. The other, I think I mentioned the example of immunization. Hepatitis B immunization is the first immunization that prevent cancer, liver cancer. So we provide hepatitis B immunization and flu immunization, of course. And right now we are doing COVID-19 immunization, working with a lot of Chinatown communities. We also, public health, like I said, try to investigate why some people are more easily to get sick than others. So public health research collect data to study some diseases. We just finished a 5-year study, mercury study for the Chinese, for the Asian women, because according to literature, mercury level is high among Asian population. Mercury is a chemistry that if you have a high mercury level, which will impact your nerve system, immunity. So it's a chemistry can damage, especially when women are pregnant. If the mercury level is high, that can impact the fetus for the pregnant woman. So we try to study why Asian women have a higher mercury level, which we found is related to their fish consumption. You know, Asian people like to eat fish, and we consider fish as a healthy food, as a nutritional. But if people do not understand what kind of fish has high mercury contamination, some the fish from the polluted river has a high mercury that we should avoid it. So then we had a good study and generate a lot of interest to to learn about what is a good fish, what is a bad fish, what fish you can not eat too much. So this,
Oh,
yeah.
sorry, Hong, we're out of time.
Okay, yeah,
So
these
sorry.
are the examples. So I really feel that I'm not proud of what I'm doing, and we help people to stay healthy. Thank you.
Thank you, thank you. You can definitely learn more with Hong in their small breakout rooms in a second. But we'll move on to our next person, and it's Jered.
Hi, good afternoon, everybody. So I'm Jered Pruitt. I'm the Chief Operating Officer for the Chinese American Service League. My job, think of it as really Vice President of the organization, and my responsibilities really focus on keeping the organization running and overseeing. We have about 540 employees and 20 programs, so a really big organization with a lot of complex issues to navigate. My career started, I actually started in child welfare. So I have a master's degree in clinical psychology focused on youth and adolescents. So I started out my career as a therapist, working with really troubled youth and adolescents who are going through some pretty significant, difficult times. And then really from there, I moved into kind of community mental health, helping adults with mental illness, helping them to kind of navigate how their brain processed information and how they related to the world. And then eventually I kind of moved up the ladder and went into executive leadership. I became a CEO at the age of 24, which is really young, and looking back in my career, a little too young for that. But I've been in executive leadership ever since in various different ways. I've been a CEO, COO. I've also been a chief advancement officer, which is kind of like a chief fundraiser. I've also been a federal lobbyist where I would lobby for community support, especially around child services, making sure that Congress allocated money to organizations that serve children here in Illinois. So I did that for a number of years as well. And, you know, finally, I was a consultant as well for many different organizations. And that's how I came into Chinatown, because I'm sure many of you are kind of wondering how is it that a guy who is clearly not Chinese becomes a leader within the Chinese community. And what I would say to you is that Bernie Wong, who you heard about earlier today, hired me on as a consultant. And she, I think she hired 4 out of 5 of us leaders on this call. And that's one of the skill sets I can talk about in the breakout session. One of the most important things you can do as a leader is hiring the right people and building that bench, building people's strengths to become the next leader. And so Bernie brought me on as a consultant to help her fundraise, and then offered me a permanent position. And I really became, I fell in love with Castle. I fell in love with Chinatown as well. I've worked in other communities, the Latinx community. I've worked in the Japanese American community as well. And but what I found, especially with Chinatown and Castle, is that it is a organization where it's really like family. And even when you're not part of family, you become part of family. And so I think that leadership, especially within the community, can be has value around diversity. You may not belong to a part of a community or come from the community or come from an immigrant background, but you can still make your mark as a leader in a community that you're not necessarily part of, as long as you instill the values and you believe in what you do and you believe in the community that you serve. That is absolutely critical to have. And I'll keep my remarks very brief, and I'll pass the torch.
Thanks so much, Jered. Yes, if you want to learn about other leadership that Jered just described, hold your questions. We'll be there soon. But last but not least, it's David.
Yeah, so I'm David Wu. I'm the executive director of the Pruett Center. I've been executive director since 1994. I was the first staff I was 30 at that time, so a little older than Jered was when he became director of an organization. But before that, I had worked a summer at Castle and then also at the Chinese Mutual Aid Association, which is up in the Uptown community on Argyle. And so as the executive director, I'm responsible for kind of the vision and direction and the programming of the Pruett Center. Some of you know us through the youth program, but we also have English classes. We serve children and have a variety of community programs. One of my roles in the community has been involvement in CBCAC. And so I was executive director when it was first getting started. And the first issue that we kind of worked together was the casino buses that were coming into Chinatown. So all of us, Maha, Castle, Pruett Center, most of our work is serving individuals, and CBCAC, their work is at a different level, trying to organize the community and trying to get the community involved in kind of engaged civically so that we could make changes. And so like the changes that we make at Pruett Center is helping people learn English. The change that CBCAC might be doing is to advocate for things. And so, so early on, we were just concerned about how the casino buses were coming into Chinatown. We worked on voter registration. And then probably some of the major accomplishments were the advocacy for the Pingtown Park, as well as the Chinatown Library. And so those projects really involve the community coming together and pushing the government to provide what our community needs. You know, you've all grown up assuming that there's always a nice library or a nice field house and a nice park. But there was a period of over 25 years that Chinatown didn't have a nice park. And it was community leaders who actually didn't work as nonprofit leaders. They're business people that just pushed. And so you could be a leader in the community from a non-for-profit organization, or you could be someone who has a business interest, or you could just be a community member, and then you just want to make your community better. The last thing I'll say is, you know, I continue to hope that Pruett Center will continue to grow, but one of the things that I hope that the community has for the future is a high school. I think some of you have heard about kind of the desire for the community to have a high school. Castle actually tried to have a high school. They actually tried to organize a charter school almost 20 years ago. So it's been a problem for a long time. So we might end up having to push for 25 years, just like we had to do for the park. But it's important that we continue to be involved in the community to make it a better place for kids like you to grow up, as well as for families and new immigrants.
Great, thank you so much, David. If you have any more questions about the high school or Pruett, definitely you can ask him. And the parks. David's also been a very strong member of getting this beautiful park. So yeah, so what we're gonna do now is we're going to be in small breakout rooms so we can get to know each person personally. Thank you so much for coming. Yeah, type in the chat something that you learned today, or type in any thank yous to our wonderful leaders. Let's take a second and applause. Thank you so much for our wonderful leaders for coming. Also, thank you everyone for coming as well and taking some time out of your Tuesday to learn about some of our Chinatown leaders. Feel free to type in the chat something that you learned today. And that's pretty much it. If you're interested in more events like this, or if you're interested in learning more about CBCAC, please follow us on social media or email me or email our info email. But yeah, thank you so much for coming, everyone. Thank you for to our leaders for sharing these wonderful stories. And please don't be strangers, stay connected to everyone. And you know, these leaders they're always an email away or always a phone call away. So don't worry about not ever talking to them ever again. But thank you so much. And I hope everyone has a lovely Tuesday. Take care.